Hello viewer, thank you for joining us. This is CBA. We are broadcasting to you live from Somaliland's capital, Hargeysa. My name is Yussuf Arte, and as always, we feature on this particular program people and organizations making change at a time when the world is fighting the pandemic, that is the COVID-19. With me here today is Arte Ahmed Yussuf from ICRC. Thank you very much for coming, Arte.
Thank you.
Welcome to CBA.
Thank you very much.
Your organization has carried out a number of activities, mainly at detention centers across Somaliland. Could you tell us some of the activities that you have carried out?
Yes, starting from this new epidemic coronavirus, we have started to support the detention centers, which is the most vulnerable places for that coronavirus. So we have tried to support them and to assist the government and the administration for hygiene promotion and hygiene dissemination or informations. We just transfer to the health organization message to the detainees and the staff as well. We have tried and we support them almost all the detention places in Somaliland, and we have assisted in hygiene items and hygiene promotion items such like soap and washing powder and dustbins and washing places for hand washing tanks and something like that. We have assist and support all that materials to the detention centers, nearly almost all of these detention centers in Somaliland.
How vulnerable are people in detention centers to this global pandemic, COVID-19?
They are more vulnerable than the other ordinary people who are not disturbed from their freedom because they are overcrowded, might be in the cells. That might cost them more vulnerable and make them more vulnerable for the epidemic disease. In case that problem happens in Somaliland, they will be the most vulnerable people because of they don't have the access to this social distance that the other ordinary people can do it. That's why they are the most vulnerable people in the Somaliland.
Mitigation has been carried out, but towards the end, not when the pandemic started peaking across the world. For example, in the US, they are showing signs that people in detention centers are asymptomatic. Yes, they are not showing symptoms, but they have the COVID-19. Do you think that places of detention have been overlooked around the world, not necessarily in Somaliland, but around the world, that we didn't take good care, we didn't start working on detention centers as early as the pandemic started?
I think ICRC only was supporting the administration about the steps that they can do, the measures that they can take before the things happen. So I think that the government or the administration already did something. They released some of the detainees to avoid overcrowding of the cells of the detainees. The other steps they did is they have to stop it at all for the family visiting in the detention center to avoid that people to contact that detainees people, and that's one of the measures that the government or the administration have did it already.
And is ICRC satisfied with the mitigation measures so far carried out by both government and non-government organizations in the fight against COVID-19?
I'm sure we don't reach the point of the mitigation, but already steps have been done. But we cannot say it has been completed, and we cannot say that we are satisfied about that. It may be there's still some steps more to do.
You have noted that 574 prisoners have been released and pardoned by the President of Somaliland as a measure to reduce the number of people in detention centers. Is that number enough?
I cannot say it's enough. Still there is some problems with the old people in the detention center, which are the most vulnerable people, and those who have already have diseases and permanent diseases, who are the most vulnerable, as the medical agents told us, that some of them are still in prison, and the government and the prison, I think they will think again to do the best solution for that people. I hope they will do.
You have talked about people of old age, people with certain diseases are at high risk in these detention facilities. But overcrowding, shared sanitation facilities, poor hygiene, limited ventilation, and access to common areas are examples of structural and organizational factors that can favor the spread of the disease within the detention centers. What do you think can be done by the government and even ICRC have done maybe to reduce the spread of this infection among this vulnerable population?
Yes, I think with the collaboration of all the concerning agencies and the authority, we should have to do more steps to avoid that epidemic to come and to reduce the risk of that epidemic in the detention centers because of that overcrowded people, and the ventilation is, of course, there is a ventilation restrictions, and as well as there is no social distance in the detention centers, which is according due to the number in the detention.
The social distancing is not there because of the population. Do these factors mean that they are at extreme risk now? Not unless something is done forcefully by the government, for example, enforcing even the way they are enforcing outside the 1 meter apart. Must they do that in prisons as well, just to make sure that our vulnerable population in prisons are also catered for?
I think due to the space of the detention centers and the overcrowd of the people, it's not possible at the moment for that 1 meter social distance that has been recommended by the international organization and health organizations. But we should have to avoid and take another steps. If we can't do that, we should have to do another measures to avoid that epidemic to be inside or to be in red color to our detention centers, such like visiting of the detainees by the families or other people, maybe relatives and friends, to avoid them and to make them the hygiene should be promoted to the maximum as soon as possible.
ICRC has been closely working with the government in fighting this particular pandemic, and prison staff as well as visitors who are entering these facilities may risk the risk of COVID-19 entering these facilities. What do you think ICRC, or what has ICRC done in line with this to reduce the number of visitors? The government has already said that no person will be visiting, but these people have families. There's human connection. So what has ICRC done along this line in helping?
We cannot do more about that, but only what we can do is to provide them an hygiene promotion and hand washing facilities in the entrance of the detention centers. And we arrange that even the cells, in front of the cells, every detainees and everybody who is visiting the area, even the staff of the prison, they should have to wash their hands before they go into the cells.
You have also provided mobile phones, I think?
We have also provided mobile phones and SIM cards to the detention centers to communicate to their family. After all, if they has been stopped from their family visited, we assist for the well-being of the detainees for that SIM cards to contact their family.
What do you think new prisoners who are detained should be done to before being allowed into the prison? What do you suggest? A person who has been arrested is back into the prison. Before going inside, what hygiene procedures have you recommended?
Or screening?
Yes.
I think the prison administration would do that activity. They should have to check, although they told me that they had stopped for new intake detainees for this particular time, for this crucial time, they have stopped, but they should have to check. They have some of the exact, for example, in the big detention centers, for example, like Hargeisa and Mandera, which is one of the biggest two detainee centers. They have a medical staff, and they check the condition and the health of the new intake detainees.
And under the international human rights law and the human rights law, detainees' health and hygiene must be safeguarded, and sick detainees must receive the medical care and attention required by their conditions. Are you as an organization satisfied with what is done? For example, you talked about Mandera and the Hargeisa correctional facilities, that they are doctors. But are you satisfied with the number of doctors at that place, as well as the number of people who are in that particular prison?
I think they have enough staff for medical staff in both detention centers of Mandera and Hargeisa, but also what they are always claiming is about the drugs. Maybe the amount of the drugs that they have is not the required standard, or maybe it's below the quantity that they will need it. But I think that will be supported by anybody who can support them, and it's open for everybody to support our detainees, those who have lost their freedom to move and to go outside. It is a common responsibility for all community to support them. I think so.
Information is vital at this critical time, and getting the right information is at a time when fake news is around us. We are not sure which, there are a lot of myths on what to do and what not to do when you have the virus, or how to prevent yourself from the pandemic. This vulnerable group that you have been working with as an organization, how do you think we can give them as much information as possible? We know that access to information inside prison facilities is not as easy as it is for an ordinary person. So what mitigations have you taken yourself as people who are working with these vulnerable communities?
I think we don't do that mitigation particularly by our agents, but we have advised it to the administration or prison directors to do that with their health staff to transmit the right messages, medical messages to the detainees, and the right informations rather than fake informations. I know there is rumors and fake information full of the mass media and everywhere, but we try our best to advise them to do their staff, the healthy staff, to do the right informations to the detainees or inmates.
You have worked very closely since the pandemic started with government and other organizations in terms of training. ICRC have been training people even outside detention centers at community level. You have trained people all around the region. But still, our people think that this virus is not even real. What do you think is the cause for that?
I think the ICRC in general, they make a press release in last month or something like that, and they make all the figures that they have been trained, the data of the people that they have trained. But of course, some people, they don't believe this epidemic is existing, and maybe because of cultural difference or something like that, some people, they don't believe it, but it's something existing. And I think at the moment, people, most of them, they understand this thing is something existing, and the people's dying, and they know, I think, from informations, and they can get the information from everywhere, from every social media and every radio and TV is talking about coronavirus. And I hope that will finish soon, inshallah.
Inshallah. And towards the end of, I think, early this month, the end of last month, ICRC had released a press release talking about that it's not very happy with precautions taken by the public. For example, it had recommended that at buses that we should always be taking care, we should be wearing masks, we should be wearing gloves, but it said that it is not satisfied with how that has been taken by the public. Has that changed over the last 1 month? How are people taking precautions which are recommended by both ICRC, the World Health Organization, and even the government?
This is something new to Somali people, to say to have a mask or hand gloves. To their understanding, it's difficult for the time being, but they are just developing. I hope they are. I just passed by the town now by today, and I saw so many people with masks and hand gloves, which was not exist before. And I hope that story will finish soon.
And this is personally, you have been around. There is a global, not for ICRC, I'm asking you this as Arte. The pandemic has been around with us, I think, since December last year. Yeah. But African governments, the world is running on vaccines, from Japan to Korea to Britain, the US, China. Everybody's working towards getting a vaccine for this disease that has stopped almost everything in our world. But African countries are not even they're not even thinking about that. Does this show the truth of Africa, and that we are way behind the rest of the world? Is this the time that it shows that, you know, we have a long way to go?
Yes, of course. I think we are a long way to go. Our campaigns at the moment is to convince our people that this problem is existing, while the Japanese are campaigning to produce a vaccination, so that we have that gap, and we want to campaigning to convince our people this problem is existing. That, I think that's the gap between the developed countries and underdeveloped countries.
And lastly, what is your message to the people of Somaliland as we fight this pandemic together, government, people in private sector, and the media?
My last message is the people should have to accept the message from the healthy organizations. They should have to accept. They should have to make the social distance. They should have to keep themselves from the others. Or they should have to wash their hands. And all that is very crucial for this time. If we deaf or ignore that messages, we will be the people who will suffer. We will be the people who will suffer this epidemic. That's what my last message is.
Thank you very much, Yussuf, for speaking to us. That was Yussuf Arte speaking to us here on CBA, and he told you that ignore these messages at your own comfort, but you will suffer if you ignore them. That is all we have for you in this particular program. Until we meet again, my name is Yussuf Arte. Thank you for joining us. Have a lovely time and take good care of yourself.